Well, taking a break from cooking to talk about a new procedure being offered in the area, and for people who suffer from acid reflux, this really could be life-changing. And here to talk about it is a surgeon from Affinity Health out of the Fox Valley, Dr. Peter Janu. Good morning.
Good morning, Amy.
Well, so many people suffer from acid reflux, and it's just not a fun thing.
Not at all, not at all. And it's one of those things that people suffer for years and years trying to cover it up with medications. But no matter what, people sometimes end up having to have further things done. And we've just come across a newer type of procedure that's less invasive and really does a fantastic job of helping people out.
Well, before we talk about the procedure, what is GERD?
So GERD stands for gastroesophageal reflux disease, which is really hard to say over and over again, so that's why we call it GERD. And it basically means that the content of your stomach is going the wrong direction. Now, acid is supposed to be in your stomach, but it's not supposed to go the wrong way, and if it does, it causes pain. But sometimes it causes other things where people get a cough or hoarseness, it keeps you up at night, all sorts of different things that really kind of affect quality of life.
And it's pretty common?
Absolutely. If you look at the statistics, anybody over 40, about half the people suffer from it, at least on a daily basis. And some of it is based on what you eat, of course, and what you do, but it is really, really common.
And it can develop, into a hernia sometimes?
Sometimes people can develop hernias. Sometimes people can develop what's called a stricture, where it makes it harder for you to swallow food. Sometimes people can get ulcers or bleeding. All sorts of different things can happen as it goes on and on.
So you don't want to ignore it, that's for sure.
Ideally, you don't want to ignore it.
And tell me about this new procedure, which you're really excited about, and just now starting to do it in this area. You're the first people to do it.
We're one of the first people in the Valley that have been able to do it, and there have been several people across the country that have been doing it as well. It started over in Europe, and basically the idea is that if people take medicines to cut down acid in their stomach, it will cut down the acid, but it doesn't prevent things from going the wrong direction. And the only real great way to do that is to do a surgery to kind of help reconstruct that valve. And historically, people would have a surgery done that was very effective, but it came with side effects. People would get bloating, sometimes swallowing problems. And so what this newer procedure does is it's a more minimally invasive way to do it. Actually, it's done through the mouth, and so there's no scarring. It still requires an anesthetic, but by reconstructing that valve, it'll help prevent things from going the wrong direction. And so far in our experience, we've done over 250 patients so far over the past few years. About 80 to 85% of the people are able to go off medicines entirely.
Wow. And
people are really, really satisfied with how big of an impact it makes on their quality of life.
Downtime for this surgery? Is it?
A little bit depends on what you do. If you do a lot of heavy lifting, we try to limit how much core work you do. So if you're a Pilates instructor, you kind of have to take a few weeks off. But the people that are kind of going to work and just kind of talking or working at a computer typically go back within that first week, sometimes the next day.
Wow. So for people who might be interested in this and might be suffering from acid reflux, how can people get a hold of you?
Well, there's a number to call, and typically what we try to encourage is people to talk to their physicians first. Because everybody's story is a little bit different and everybody's a little bit individual, and so you can't necessarily piecemeal one thing for everybody. But if you talk to your physician, sometimes the physicians don't necessarily know about some of these newer procedures that are available. And so I encourage them to discuss that and see if that's something that they might be interested in pursuing, trying to get off of some medications or whatever. Certainly lifestyle changes. If you're used to eating a pizza right before you go to sleep and you complain of heartburn, you should stop eating an entire pizza before you go to sleep. But at the same time, there's people that have been on medications for years and years and years and still suffer because the medicines don't do enough. Those are the people that are the ideal candidates to try to consider doing something for that.
Yeah, and very cool. It's working and
it's
doing it right
fantastic.
in our backyard. You don't have to go to Chicago to get done.
Absolutely.
Great.
Absolutely.
Thanks so much, Doctor. Appreciate it.
Hey, thanks for having me. I appreciate it.
You betcha. You betcha. Anytime. And again, you can get more information by contacting Affinity Health.